those who don't know me, I'm the founder and the chief editor of the Localization Fireside Chat. It's a two-year-old channel. It's been gathering a lot of steam out there, and I hope people still enjoy the content that we're providing. In the past couple of years, we've recorded almost 110 episodes. This episode, I think, would be number 110. So we've talked to many opinion leaders in the industry, many opinion leaders from the outside the industry, looking into the industry. And today I have the honor and distinct pleasure to be joined by an amazing group of ladies to talk about the interpretation status and interpretation situation in Canada. And we will address this from various angles: standards, professionalism, proficiency in providing the interpretation, etc. Before we dive into the topic of the hour, if you don't mind, we'll start with Angela. Like, this is the way the screen rotated around me here. We'll start with Angela. If you don't mind giving it a bit of an introduction, and we'll go to Sylvia next, and then Grace, Kieran, and Elena.
Okay. Well, I want to thank you, Robin, for having us. There's a little bit of feedback. You okay? But I also want to thank you for bringing in the Canadian perspective. I think that it's very important because we have a very different landscape in Canada from the very beginning of when interpreting services started. So my name is Angela Sasso. I've been around for many years, not just as a human, but also in the field. I started in the late 80s as an interpreter. Volunteer interpreter, because that's all we had out here in Vancouver at the time when it came to public sector interpreting, and then moved on to managing an LSP, a language service provider that became one of the first, if not the first, social enterprise in Canada. Mosaic, it's still around here and doing well. And since then, I've worn many different hats. I'm a researcher. I develop curriculum. I train, I educate. I currently have two different businesses. One is the Interpreters Lab, where we train interpreters or bilinguals to work as interpreters. And we also provide ongoing professional development education to practicing interpreters. And in addition, and then I also have a consulting company called Shifting Pictures. In addition to all that, I also volunteer a lot of time. I have been with the International Standards Organization, ISO, since 2010 as an expert at their TC 37 SC5, which is the Committee on Translation and Interpreting, and was honored to have led a project that just was published last year on requirements and recommendations for training in interpreting, or for training in community interpreting. And I'm also president of Critical Link International, and I'm also on the CLIA board here in Canada, our Language Industry Association. Was that too long? Awful sorry.
You're very involved. We're very involved.
I'm very involved.
We appreciate your passion for this. Thank you so much for your introduction.
Thank you. And I wanted to also say you could not have picked a better group of delegates today as well. I'm very honored to be here with these four wonderful women.
Pleasure's mine. Good to have you. Sylvia?
Hi, my name is Sylvia Salabarde. I'm very, very happy to be here. I'm very honored to be sharing the space, as you mentioned, with this wonderful ladies who have been so involved in the profession. So I have been a translator and interpreter for many years, and I'm currently the president of the Society of Translators and Interpreters here in British Columbia. And I'm also mostly responsible for the interpreting certification exams nationwide, except Quebec. But for the other provinces, they all come together under this umbrella of CITIC, who's the institution that provides a certification, and I'm kind of in charge of that, of the exam part. Yeah, I'm also a working interpreter with many years experience doing all kinds of things, court, medical, community interpreting, whatever is needed. I feel like I'm an interpreter by vocation, and thank you so much for inviting me.
No problem. Thank you for the introduction. Appreciate it, Sylvia. Good to have you with us. Grace.
And you'll be hearing thank you from all of us. So truly, and thank you for the opportunity to take part in this chat and with these amazing women. So I'm Grace Egan. I'm the Director of Language Services and Digital Strategy at Access Alliance. We are a community health center and also offering interpreting and translation services to other health and social service providers across the province and even to some extent across the country. I've worn a few different hats related to interpreting over the years, from frontline interpreting in acute care to educating clinical providers on how to work effectively with interpreters, helping to roll out remote and phone interpreting in several large health service institutions, and now overseeing the interpreting and translation here at Access Alliance. I've also been really fortunate to be able to participate on a couple of boards relating to interpreting, so the Healthcare Interpretation Network as well as the OCCI, the Ontario Council for Community Interpreting, and both that were really pushing for standardization and professionalization within the community interpreting sector here in Canada.
Absolutely. And Grace, glad to have you with us. Thanks for joining. Appreciate it. Thanks for the introduction as well. Kieran.
Really, again, thanks for inviting us, Robin. Appreciate having this opportunity. Often I feel like when I'm asked to come to these, I feel like I'm not really the expert in, especially when it's with all of these women. So let's see what this brings. My background is I come to this from an equity and access lens. That's kind of where my work started in immigrant services, and I was involved in setting up a lot of the interpreting services across the Lower Mainland in British Columbia. So this is back like starting in the 90s. I'm going to date myself a little bit. So yeah, it's been going on for a little bit. Right now, I am the director at Provincial Language Services. We're part of the Provincial Health Services Authority, so providing again that equity and access lens to language, and our services span spoken and sign. So it's a little bit of everything. So that's kind of what my background is. Yes. Thanks.
Well, thanks for being with us today, Kieran. Appreciate it. And I appreciate the introduction. And I'm sure your perspective would be valuable, especially in the context which you presented today.
Good afternoon, everyone. It is such a pleasure to be here with all of you this afternoon. I feel very fortunate to be part of this group today. My name is Alana Carlisle, and I'm the provincial lead for the Language Access Interpreting Services program with Shared Health in Manitoba. Shared Health is the provincial health authority in our province, and so we are very fortunate to have interpreting services embedded right into our health system in Manitoba. So I have the great privilege of leading a team, a very large team of diverse interpreters, so that we can support health equity, accessibility, and patient safety when delivering health and social services in our province. I've been doing this work for just under 20 years now, and I've been leading the team for 10. My background is actually in translation, which is my formal education, but very shortly after completing my studies, I quickly realized that sitting with my dictionaries wasn't exactly what I was looking for. And so I have a great passion of being able to share language skills to really make a positive impact in the lives of newcomers and underserved populations in our province. So I'm really looking forward to this conversation today. Thank you for having me.
Well, great to have you with us, Elena. Appreciate it. And I'm sure by end of this conversation, the audience was listening to us live or be listening to us in the future when we post this episode on the channel will be enlightened because this is the first time we do this kind of discussion for interpretation in Canada of its kind. So you guys are the trailblazers, if you will, in this kind of a context, if you will, when we talk about interpretation in Canada. And there's a lot to cover. There's a lot to be talking about. But before we get into the topic, I'd like to get the geography straight. So I have Sylvia in Vancouver, Angela in Vancouver, Elena in Manitoba. Am I correct,
Winnipeg,
Elena?
Manitoba,
and
yes.
Kieran in Vancouver, correct? Absolutely. And Grace, you're in Toronto, right? So Grace and I were on the east side. And, Elena, I don't know, Midwest, I would call, right? Is that what it is? Midwestern Canada. How is that? So to be specific. And the rest is in the western region of the country. And today's topic, we're going to be talking about interpretation for a reason, because there's a lot of opinions going around in terms of what interpretation is. And specifically, those opinions are coming from either the interpreters themselves, the consumer of interpretation services being the person who'd been interpreting to before. And there would like to set the record straight in terms of what is going on in the interpretation sector in Canada. I guess, I don't want to name individuals to start the conversation, but because we're six of us here, so what I'm going to name, unfortunately, I apologize about that. And we'll do a round robin in terms of getting your opinion. If somebody we'll start with Angela, give us since you've got a research background, you train the interpreters, you teach them, etc. What is the lay of the land right now from an interpretation perspective in Canada? Can you give us a broad view of where we are?
That's a big question. And I don't think I can answer it by myself, but I will say that maybe what we need to do is just kind of hone in on what we're talking about when we talk about interpreting. And I think what we're talking about, and we have three people that are, kind of specialized in healthcare here, but really we're talking about public sector interpreting, which in Canada, and this is one of the difference between us and the US, that generalist approach typically includes everything almost up into courts, and everything else outside of conferences, businesses, and diplomatic settings. So it's a wide range of services that we're talking about, just so that we're clear. And also typically we're talking about primarily migrant languages, although I think maybe the discussion today will also start looking at Indigenous languages or bringing some of that in. And along with that, languages of lesser diffusion, of course. What is the landscape? I think from my perspective, from a perspective of the ISO, from the perspective of the research, we are a little fragmented. I think it's time to build some cohesion. We are fortunate enough to have had a compendium of standards that have been published through ISO for interpreting on medical, healthcare, community, legal, general standards. And I think that would be a wonderful foundation for us to kind of revisit our foundation here. And we have a lot of really good, as you can see, right, some really good passion and desire to connect. So we have good networks and relationships, but I think the picture, and hopefully, as we go around, we can see how the picture is different in every.
Sylvia, what's your take on this?
Yeah, so I'm just going to echo a little bit of what Angela said. So we're a very diverse bunch, at least here in British Columbia, in terms of the interpreters. And there is also, I'm just going to bring up the subject of professionalization, or the professional aspect of interpreting, which I think it's a very key point that we need to talk about here in Canada and in many places, right? Because I think there is still a little bit of a feeling in some quarters that anyone can interpret. Oh, my cousin speaks Spanish, speaks French, they're coming. So, I think it's very diverse. We have amazing professionals, we have amazing institutions, we have the Society of Translators and other institutions that sort of bring together interpreters and help us all to understand our own worth, what we should be charging, and what we should be saying to people when they, unfortunately, a lot of the time, they might question the professional quality of interpreters. So I think there is a little bit of everything from where I'm standing.
Absolutely. Thanks, Sylvia.
Thank you.
Grace?
Again, I'm not really sure where to start with this one, but building on, I think I'm just going to pass the baton and build on we're moving toward being able to define better what interpreting is. So in our landscape, we're talking about community interpreting, and even that took some work to get to the point that we could define and have a term that refers to the type of interpreting that happens in our spaces. And so as we start moving toward being able to say what it is, we're also trying to move toward who can do it and what it takes to do it, and then also who should be accessing it. So if we build on its community interpreting, we can still sort of work to all be on the same page about what that means. Then who can do it? And we have differing credentials, differing qualifications across the country for who can interpret and in what capacity. So is it always in a professional capacity or is it volunteer? And then how it's accessed. So a lot of building on Kieran talking about equity and Elena on safety, a lot right now of the provision of interpreting is driven by the health service providers, and they're the ones who are determining when and where is required. So I don't think we even have a standard across the country. We're trying to, by opportunities like this coming together, to decide, do we have sort of a set of criteria for when we put interpreting provision in place. But I think that's another just state of where we're at. I think I'm just going to end there because we even the access to interpreting isn't standardized across the board.
Absolutely. No, I agree. It's a broad topic that we're trying to address at the beginning of this conversation. But then what we'll do is we'll zoom in. There's a couple of extra questions here that, as we define, as Angela was saying, let's hone in on what do we need to explain to the world about when it comes to interpretation in Canada. Kieran, from your perspective, you brought up a very good, important point: equity. In the context of that, where do you think we stand right now?
Where do I think we stand? I think we stand on the side of trying to make as much change as possible within a system that is massive. So it really is whatever can be done to bring that information about what an interpreter is, as Grace is saying, like, what is an interpreter? What does it do? What is the benefit to the system, to the patient, around patient safety, as Alana was saying. Bringing all that information in is really important. I think that sometimes we have, within the system, you have, and I'm talking about healthcare when I say system, because that's where I'm from. You have people who value what an interpreter is and what that brings to their encounter and understand the positive health outcomes that come from using that interpreter. Or sometimes you have the rub against a system that doesn't quite know how to integrate that well. So it's easy because the things that we're always balancing is what is obviously the benefit to the patient, what that means, what are the health outcomes, but the ease of the healthcare provider, because we're trying to, in an already overburdened healthcare system, how do you ease the burdens on the healthcare provider in trying to bring this in? It's quick, it's easy, it's what they need. So this piece around, as Grace was saying, about not knowing where to use an interpreter, it's also like what kind of an interpreter, because people are moving more to virtual interpreters. And is that really the best situation in all cases? Like when we're talking about MAID, medical assistance for dying, probably not the best case. So really, like, even getting that focus or that standard across, where is virtual interpreting okay? Where is it definitely go ahead? And where is it maybe you should consider an in-person interpreter? Like, those are the kinds of conversations that I think we haven't really had across the nation for sure. And we're just figuring it out individually as we go.
Absolutely.
So I find this very interesting. Having the opportunity to answer this last actually makes me feel very lucky because, we started off by saying that across Canada, we maybe have some fragmentation in the way interpretation is seen and the way services are delivered. But hearing all of my wonderful colleagues speak before me, I can see that there's probably less fragmentation than we perhaps think. And we are quite aligned in many of the things that we're saying here today. I can draw a lot of parallels to what's been said already. Kieran in particular, I can relate well with what she's been speaking about, because I too am working in a healthcare context within health systems in Manitoba. And what I'm seeing as quite interesting is that we're starting to find more and more opportunities, at least in Manitoba and hopefully across Canada, to make connection points with other areas to leverage the work that we're doing in interpretation. So finding those connections with patient safety in healthcare, with equity teams, equity, diversity, inclusion, with ethics teams in general, right? Accessibility planning committees that exist in our various provinces. So using those different platforms to really, because the message is the same, right? And being able to use those to leverage the work we're doing to enhance education for healthcare providers, healthcare professionals, as well as the individuals that we serve, to really enhance that understanding of what we're trying to achieve to enhance patient safety through professional interpreting.
Well, thanks for...
Sorry, can I just add? Elena, I love that point, because that is so crucial around people understanding their obligation and really leaning on those legislations that help build that, help support that equity piece. Like in BC, we've got the Accessibility BC Act that is coming, and we're all kind of, having to figure out how we will be meeting these obligations as healthcare. So it's just so important to lean on those as much as we can when we're trying to move this stuff forward.
Absolutely. Just a general question. I know I'm surrounded by experts in their domain, but I'm going to consider here the people who are listening to us. Probably they are not as well versed in the topic that we're talking about today as, some of the other experts that are going to be on the phone on the devices listening to this. Now, defined, like, first, in Canada, there's 10 provinces, obviously. In the US, they're working on some sort of a national standard for interpretation, specifically speaking in the healthcare sector. That takes into consideration training, education, certification, a bunch of things. In Canada, where are we with that? Is it still provincial to a large extent? Do we have a national effort for coast to coast? Do we need it? I don't know. Your opinion matters to me, I guess, in this case. Elena, you finished last. You're going to go first.
So I would say that across the country, there isn't one unifying guideline in that respect at this time. However, we have different things that I think industry professionals are relying on and referencing to help guide our work. And so some of those things would include the ISO standards that Angela previously mentioned. So there is an International Standards Organization committee looking at interpretation, translation, and related technology. So there's some great standards there, including healthcare standards, community interpreting standards that can help guide our work. There's also a national standard guide for community interpreting that proposes ethical principles and standards of practice for interpreters. So these things exist, but there isn't necessarily an overarching requirement that all interpreter services providers across Canada are following these things.
Kieran, from your side, what's your opinion on this one?
I will say just to start that it is 10 provinces but 3 territories, which we have to keep in mind, particularly when we're talking coast to coast to coast, and particularly when we're talking about interpreting in the larger context of our language constituents in Canada, which is migrant languages, deaf, blind, hard of hearing, our minority language speakers. So for us in BC, that's francophones, and then Indigenous. So the Indigenous languages is an important piece to consider because there's a lot of stuff coming out of Nunavut too in terms of how they're integrating interpreting services into their government. Just wanted to have that as an aside. In terms of this, I totally agree with Alana. I think that we all, as we push this out, like the 3 cornerstone standards, like for me, which I think we all agree, like it's around accuracy, fidelity, impartiality, confidentiality. Like those, I think we embed with it, everything that we do. And then we have the ISO standards to, again, draw from. And we try to do that in terms of how we embed that in our contracts, because we contract with interpreters as well as other agencies. So really it's about how are we embedding those within contracts to at least bring some life to them. So they're not just, things that we refer to, but they're actually there in action.
Absolutely. Grace, you want to add something?
So I'm glad the territories were mentioned, because while we do have some standards that have been written at moments in time, we always want to be mindful of regional realities that might mean that we have to interpret or apply any of the best practices or the policies that we have. And then I think we also want to be mindful that there are some sort of timely and evolving contexts. So and I don't think AI has been really built into any of the policies or the standards that we've got, because some of them are creeping up on 20 years old now. So we also have, and the efforts to maintain them haven't been consistent along the way. So so being a big country, times are changing, and we have some documents that aren't really living documents.
Mm-hmm. Can I jump in, Robin? Because I just wanted to add to what Grace was saying. Yeah. I think that living documents is so important. And, with reference to the standard on requirements and recommendations for training, we're already going through a revision, and we will be including asynchronous learning, which is something we didn't touch, and AI and technology as well. With regards to the ISO standards, they tend to go through revisions every 5 years, my ISO speak comes out. I start listing numbers. Sorry, the community interpreting standard was just republished last year, after going through systemic review. I also want to talk to what Kieran and Alana were talking about in terms of different language constituencies, because it's also very important. And I think it's one of the things that kind of almost fragments us in being able to come together around policy mandates, let's say, because when we're looking at our Indigenous languages, our official languages in minority situations, and our visual languages, they have different privileges and different forms of legislations, and migrant languages don't really, unless so for example, Sylvia can speak to this too in terms of access to court and legal services. For migrant languages, unless it's embedded in a mandate or a policy on a regional or provincial level, they're not really necessarily, addressed. So even within the access needs that we have for the different languages, there's fragmentation. So it's what threads do we pull together to create a universal or a common, approach.
That's right. There's a lot of moving pieces to this, it sounds like, Angela, right? Sylvia, anything you want to add on the topic?
Yeah, it's an interesting topic for me from my perspective and my position, especially in terms of policymaking and my connection to CITIC, which is a national organization. In fact, Quebec is not part of CITIC now, but they used to be. And basically, that is a big part of standardization, I would say. In fact, I mean, it even goes into legislation. So even though interpreting remains a provincial issue because the Constitution says that regulation of professions is provincial, right? So we're kind of in a little bit different in that respect from stuff like the APA. Not that they do interpreters, but I understand that in the United States the landscape is quite different. There isn't like that division into provinces or states or anything like that. So I do think because we do have exams for basically certified community interpreter and certified medical interpreter, as well as court. And I do think that is supposed to be also another kind of standard, and it is built into the legislation in some provinces. For example, here in British Columbia, we have title protection, which is really an amazing achievement because I know there are other professions that are fighting for that, including here, for example, clinical counselors. You would think they would have title protection and they don't. A certified community interpreter, certified medical interpreter, there's title protection for that here in British Columbia. I know there is in Ontario as well. And I think alongside the ISO standards, that's also something that can bring us together and kind of give us a sense of what is the standard, what is an interpreter, and how do you know when an interpreter is good, which I think is very important.
Yeah, I think we started the conversation by saying, we moved. I don't know if it's still around, but there used to be a time where if you speak the language, you could do an interpretation. You could do interpretation. A relative, a cousin, whatever. They used to I was dragged into a situation where I'm doing interpretation. I'm not qualified to do interpretation at all. The fact that I understand the language, it doesn't mean that I understand, the medical terminology. For instance, I was with somebody at a hospital doing some interpretation for I was a young guy, and I didn't really understand at the time. Like when you're talking about, 20 years ago, these things did not existed. If you trying to help somebody, you try to help somebody. That's it. Now, what in Canada? I'd like to get your opinion, like each one of you. What makes a good interpreter? Like, what is an interpreter in Canada? Is it the language? Is it the proficiency in certain topic? What is it?
Sorry, Robin, because I want to follow up on something that you said. That you said just because I speak the language, interpreting, and it's a bit of a pet peeve of mine recently that we reduce interpreting and translation to language. It's not about language. It's communication, and it's a full breadth of communication. The other thing too, when you're talking about interpreting in public sector services, particularly in healthcare, but everywhere, including courts, it's about the individual's right to be heard and to hear, to have that autonomy and that independence, the confidentiality and the respect without any intervention. It's not about how much medical terminology you know. It's beyond that. It's really being able to respect the communication that happens between the provider. And I think when we talk about interpreting and translation, even really as just about language, it denies all of the many multiple things that are there that are very important.
And somebody was mentioning AI earlier, and this is the human part of it, right? So you're not injecting a dry translation topic from one language to another. You're injecting humanity into it. And I think that's where you're going with this one, right, Angela?
It's beyond humanity, but sure. It's more about help me out, guys. What's the language I need?
I'd love to hear explaining it. Go ahead.
No, it's more about, like I said, it's about communicative autonomy. It's about having the autonomy to speak and to be heard without any filters. And even if, framed by a professional understanding and identity. Okay. So even if somebody is bilingual, if they're not trained in what that means and what it means for the system, as well as the individual is not speaking the language of the system, if they're not trained, then that can go very, very wrong very quick as well. And I think that comes down to language equity, language access, and that's really where things get couched, embedded to move beyond just the language.
Elena and Kieran, you buy interpretation services, I assume, because you're in the healthcare sector, right? So do you buy interpretation services, or am I assuming wrong?
We have contractors. Sorry, Alana, go ahead.
So the model in Manitoba is actually that within Shared Health, we hire interpreters. So they are all employees of the Shared Health organization. So they go through very rigorous screening and selection criteria as an initial start. And then qualified individuals are actually sent for training. So we offer in-house training. It's 12-day, 72-hour training program, which is a condition of employment for individuals to complete prior to being hired as interpreters with Shared Health Language Access. Further to that, because they are employees, they are paid for ongoing professional development. They go through regular performance and quality monitoring and have to abide by all the same policies and procedures as any other healthcare employee in Manitoba. We also
Elena,
sorry, go ahead.
Just got to ask you, it's like just an important question. Like, Canada is known to be a bilingual country, and I heard Angela and several of you mentioning that there's many other languages other than the official languages to cover. In your case, what languages do you cover?
So right now, my team comprises of 97 staff interpreters, and we provide service face-to-face and remotely in 40 different languages.
And one of the biggest challenges, and I'm assuming Manitoba is it's not different, is geography comes to play, right? In Canada, everywhere, right? So how do you manage that dispersed geography and a small number of population in each corner of our country that requires those services? Do you fly them? Do you drive them? Do you try to hire them in those locations? What happens?
Yeah, so that's definitely an area for further improvement, I think, in Manitoba, because our province is interesting that we have one major center, being Winnipeg, as our largest urban center in the province. The vast majority of our staff interpreters are physically located in the city of Winnipeg. So we provide face-to-face interpretation primarily in that urban setting and slightly beyond as travel is realistic. Further to that, we leverage our ability to do some remote interpretation to support the rest of the province. But it's definitely a goal moving forward that we hope to identify key language needs in other small centers so we can further develop capacity to expand to be able to provide that in-person interpreting in those areas as well. Because as Kieran mentioned earlier, there are some best practices helping to guide us when we really should have, or it would be safest to have an in-person interpreter compared to a remote interpreter.
Absolutely. Kieran, how is it, like, based on the same topic for you? How is that delivered?
Yeah, so we do have some throughout BC, Lower Mainland, some staff interpreters, but that is not the interpreters that are employed. But that's not the majority. For sure, the majority is around folks that we contract with. So we have individuals that we contract with to provide our interpreting services, as well as different agencies if we are unable to fill that request based on who we have. Like if there's a language that we don't have in our pool, or then we can reach out to agencies. So we do.
Yeah. And the number of languages you cover is how many?
For in person, it's probably 50 languages.
Okay.
But by extension
you cover the major languages.
By extension of the agencies, it's like 200 or something. Yeah.
Of course.
Yeah.
So you try to accommodate the person regardless of their language, I'm assuming, in that regard, unless there's some obscure languages that probably you don't have a capacity for staffing for.
We do try it. Yeah.
Try the best for that. Grace, any comments on this particular topic from your side? I'd love to hear your opinion. Sorry, you're on mute, I think.
I am. Okay, so I think just as a sector, we're working to be as responsive as possible with the resources that we have. So when we are, being a Toronto-based agency, the furthest that we've needed an interpreter to travel is 6 hours away for a remote part of Ontario. And that was because it was a situation that did require an in-person interpreter where, it's a juggling act. What can we do? What's the best that we can do with the tools that we have for the situations that we need to support? And so sometimes there will be some situations that logistically it is going to be, I don't want to say impossible, but almost impossible to get someone there in person. So what is the next best thing that we can do? And I think that's just a lot of the work that we're doing right now is just how can we, and I'm going to loop back to your question about what is a good interpreter, and I'm going to twist that a bit because it's what does the individual with the limited English or French need? And I think the three things that are going around in my head right now are safety, comfort, and agency. So what do we need to do to get the interpreter in place who can achieve that for the individual?
Absolutely. Thanks, Grace. Appreciate it. Sylvia, anything you'd like to add on this?
Yeah, so I am very interested in this particular topic of what is a good interpreter, because I think it's just something that is not talked about anywhere near enough. And Angela was saying that it's not about language, and I agree, or language is not enough. Although I would also like to stress, and this is just my personal opinion, that especially having this connection to exams, to a lot of people who want to be translators, that often that language piece is not as easy as it sounds. Your bilingual cousin, your friend who's coming to the meeting, how good are their language skills? Because a lot of people get by in life. So I think first of all, so it's like, if you're going to be a good interpreter, your language skills have to be top notch. And I'm talking about, like, you're going to be in the 5%, the top 5% of people. You can't just be anybody who gets by in another language, which is, so I want to stress that that's not an easy requirement, that, oh, just because you're bilingual. No, it's not easy to be bilingual at all. I think if you look it up on Wikipedia, you'll see that the current academic understanding is that most people will never achieve full bilingualism in a second language. So that's how hard it is. Interpreting is really hard, and even the language aspect is really hard. And then on top of that, like once you get to that very high level, you have all the other stuff that I think is extremely important about ethics, about having the training, because there are a lot of interesting situations that you find with interpreters, right? Like often the interpreters feel socially awkward, let's say. So they want to add something to the conversation to make it easier. Or let's say you're with the patient and the patient wants to confide in you, or the doctor is talking to you rather than the patient. All of these things are absolutely real. They happen like every single day. And it's very important that we have amazing language skills, good understanding of the subject matter that we're dealing with, whether that's, for example, medical. For sure, it's like life or death in some cases. And on top of that, training that equips us with what we need for how to deal with different situations. So I think being an interpreter is a very tall order, and interpreters deserve a lot of professional respect, which they don't always
Absolutely.
get.
So this, I'm listening to this and I'm thinking here, we need to have high standards. That's what I'm hearing you say. High
Mhm.
standards for interpreters. They need to have bilingualism, as Sylvia mentioned, which is not easy to get. We need to get them certified. They need to go through testing process that Sylvia mentioned earlier through the Society of Translator Interpreters of BC, and I think you got the CITIC as well. You do some work with those guys too. So there are some requirements for those individuals. And we're talking about individuals here that I'm just getting to the economics of things, right? So, I'm a bilingual. I want to be an interpreter. What is the likelihood of being able to become a full-time interpreter? And I know there's thousands of individuals that probably do the work, but maybe I want to say 20% of them, if I'm being generous, they will be considered full-time interpreter. That they're busy 7.5, 8 hours a day. In your view, where is the economics of things now? Do you think interpreters are okay financially? Do you think they would use more hours? How can they get more hours? How many of them are getting like full time? Any perspective on this? I know it's not solid data, and I'm not asking for solid research. We're not doing, an Ipsos read kind of a conversation here. But any Angela, what do you think of that? Like, I mean, you meet these guys and you work with them all day.
I have a lot of ideas.
Okay.
And talking about solid data, actually, I did finish a research project last year that demonstrated one of the hindrances, one of the blocks, one of the bad things that we have in the field is exactly everything we're talking about right now. People don't understand what an interpreter is. So there are a lot of people that look and sound like a bilingual are out there working. And that takes work away from trained, dedicated professionals. And we have seen some good people leave the field because of that. So as Sylvia was saying, to speak another language is great, but to speak another language when you go to the Ministry of Social Services, the parole office, the emergency room, the IRB hearing, or you go to, the mushroom farm because there's been an incident or rehab, that's a lot. And that's what interpreters in public sector services do. They are in different places all the time. And the nuance around language, the terminology, the jargon is a big thing to keep up. So when we have bilinguals that go into the field that are not trained, they're just bilinguals, they tend to hurt the opportunities for trained professionals. I think there are a lot of good opportunities for interpreters. Should the system, our systems actually use interpreters. There's good opportunity for work there.
Okay. Anybody wants to add on the economics of being an interpreter? Who wants to jump in? Sylvia?
Well, all I have to say
I mean,
about
you did the interpreter. You still do interpreting job.
I do. I think it depends very, very much on your situation. And for example, I interpret Spanish, which is a huge language nationwide and here in BC. And I think if you are a Spanish interpreter and you're the kind of person, because a lot of us are not employed by anybody, right? Like at least here in BC, we're all like freelancers. So as you know, when you're a freelancer, you have your own business. It's all about also your personality and the extent to which you're involved in different things. I think a lot of people in certain language combinations combining different things and as freelancers can make a living, even a good living if they're good and they have a little bit of business savvy. But obviously that doesn't go for all language combinations. There might be some where there is just like a couple of interpreting gigs twice a year, kind of like goes against. It's a little bit tricky that it is like that, because that means if you're not making money full time, how much effort are you going to dedicate to training and all of that? So I think that's a pain point that a lot of us find in this profession.
Absolutely. Anybody would like to jump in and add a few more points on this one? Grace?
Just to build on what Sylvia was saying there, I'm glad we're sort of looking at the languages that are either of lesser diffusion or are in less demand, because if thinking of our agency stats, last year our in-person interpreters supported over 120 languages, but the top 25 represent almost 89% of that. So the volume and the number of gigs for interpreters for the languages that aren't requested as often, just exactly what Sylvia was saying. We have the same expectations as far as their investment in their training, their professional development, their preparation for every single assignment. So, not addressing your question about economy in terms of dollars, but we do have to think about what can we offer to those individuals who bring those amazing skills to the table, but we're going to be calling on them much less frequently than for the top demand languages.
Because I assume like in the rest of the industries, right? So when your qualification go up, you're going to ask for more money, but in an industries where price pressures are everywhere, right? So I'm assuming the same thing is happening in the interpretation world where people want cheaper, faster, better, etc. So, but they don't want to pay. They want a high qualification, but probably they don't want to pay more for that. Does that work? Does that happen to you, or is that part of your equation, or what?
I feel like we're getting into tricky territory, so I'm hoping we can.
I love tricky territories. That's what the channel's for.
I want us to, if we can stick on the equity word. I hope we'd never see a barrier to access to a language because of
money.
Yeah, yes, but I mean that's secondary. But we don't want to set up a system that creates a disparity in access to an interpreter as a trickle-down effect of the opportunity for interpreters when their languages are in less demand. Okay. I know I'm not answering the question directly, but it's a tricky territory.
You want to add anything else, or?
I'm looking at the other tiles on the screen, hoping someone's going to save me here.
Somebody, Bell, Grace, please.
I agree with you, Grace. Obviously, it is tricky territory. And I do think that focus on equity is so important in everything that we do. In the fact that we're trying to deliver service in a system that sometimes isn't as fair to marginalized groups. And the fact that we are using folks who are part of marginalized groups to help support the system in creating equity. And what is it that we can do to ensure that safety as well? Because there is considerations around our interpreters and their safety, be it economic or whatever it might be. And what are our considerations is always the question that I put forward. And this is coming because we're working on introducing Indigenous language access. So that is a question front of mind for me. What are the considerations around decolonizing and indigenizing training that is out there right now for interpreters? So when we're taking it to Indigenous community, what does that mean? How do we need to look at the process that we've set up, which we should all recognize that the process that we've set up are very colonially based processes. Interpreting comes from conference interpreting, very colonially based systems. So we just need to kind of always ask ourselves, I think, whether it's for the patient in healthcare or the interpreters that we're bringing in to support the patients in healthcare, what are the considerations on both ends around equity and safety, and what that means for us as the ones who are responsible for, integrating, bringing both
Absolutely.
together. Yeah.
Absolutely. Alana, anything on your side?
Just perhaps to build
the
on,
topic?
what Kieran mentioned, and I know we've kind of taken a turn from your original question, Robin, but talking about safety for the interpreters themselves, I think is a really interesting and important topic, and one that, it is great to have here together as colleagues, because that can be often overlooked. But as Sylvia mentioned earlier, the work is hard. Interpreters do incredible, amazing work. They are professional superheroes. And it is our, I think, responsibility to support them in the best way that we can so they can do their best work. So ensuring that as we build our policies and best practices around the delivery of interpreter services, that integrated with all of that, we're building in emotional and psychosocial supports for the interpreters as they do their work, opportunities for debriefing, opportunities for connection and relationship building with their colleagues, because the work of a community interpreter is also very independent and can be isolating and lonely. Perhaps you're out there in the field interpreting every day, but you don't ever see your colleagues. So finding opportunities to debrief and learn from each other as colleagues, that ongoing professional development, quality monitoring, performance evaluation, all of those things need to be built in with our policies for the simple delivery of the service itself. Because if we're not taking care of our interpreters, we're going to be making investments in wonderful people that we then lose from the industry because it's not a safe work environment for them.
Elena, on the topic of equity, I know Kira mentioned there are some advancement in terms of putting some ideas out there for advancing the idea of opening up the language access to groups that perhaps today don't have access to that. How's that going on the policy side from an equity perspective in Manitoba?
Well, what's really exciting in Manitoba, actually, that just in December last year, a shared health executive approved a new version of our interpreter services policy. So we do have a policy within our provincial health system that guides staff on all of the scenarios when they really must be requesting the services of an accredited professional interpreter. And this includes for Indigenous languages as well as immigrant refugee languages and sign language as well. And so this is being adopted across the province, and it is a really great leverage for us as we're doing staff education to remind people about that, their responsibility as health professionals to take the extra step to engage with a professional interpreter to enhance safety for the patient care that they're delivering.
Absolutely. Anybody like to jump in and add a couple more points, or we jump into another question? Okay. So we talked a little bit briefly about it earlier in terms of the availability of the translator, the interpreter in the location where you want them. And that aspect of travel, Grace, I think mentioned she had to send somebody for a 6-hour drive to get to the location where that individual is needed. And we spoke a little bit about AI earlier. I'm not going to dive into it because it doesn't apply here in this particular context. But there are many other tools that people are using right now, which is it's worked to our favor, but you got to look at it from an advantage disadvantage point of view. What about video remote interpretation or any of that types of tools, technologies? Any of this entering your space, or still pretty much a human face-to-face effort? Are you contemplating other things? Angela, you want to guide us through the first aspect of this, and we'll move around.
Well, I'll let the three direct service providers talk about the use of and remote tools for interpreting. But I do want to say one thing, just as an observation, which I find quite interesting. I think that when we went through, so Kieran said, conference interpreting started. Actually, interpreting started long before conference interpreting. Conference interpreting was kind of solidified during the Nuremberg trials, and then we became very siloed. And I think COVID kind of started blending public sector community interpreting with conference interpreting more. And now what I'm finding is that AI is actually causing more of a wedge between what we do in public sector interpreting, community healthcare interpreting, and other aspects. It's not, it's just an observation. Remote interpreting, definitely a good tool. Definitely, I think Grace was talking about before, how do you convey some of those important aspects around security and safety remotely? You need to also be aware of that, cognizant of that. But in terms of AI, I can feel it's kind of moving away or causing a wedge between us, once again, us, and other sectors or areas of interpreting. And I don't know if others feel the same way, but I just feel like it's not necessarily a blend for this area of the field.
Yeah. Grace, anything on this one for you? I mean,
I think, again, we've got all of these modalities and they all do have a place where they work. And I think we just have to do a good assessment of what is the context of the situation where the individuals are speaking. What are their communication needs? And again, like Angela, thank you. We do also need to be talking about big C communication when we're talking about interpreting. And so there is a place for each of the modalities, and we just have to support the end users to know what do they need and what is the best fit for the type of interpreting, but to achieve the communication goals of that encounter.
absolutely. Absolutely. And this is the whole communication I think Angela started the conversation with, in terms of what is the purpose of interpreting, is that communication piece, which is we need to keep in mind regardless of the tools you're using. But in a large geographically dispersed area like Canada, for instance, one can't help wondering, in order for us to afford equity to everybody and equal access to languages, etc., you may come across certain languages that they're not available in your jurisdiction, but it doesn't mean you're not allowed to get access to the language translation or interpretation. Or maybe technology can help you. And I'm not talking about someone replacing the human. I'm just talking about a medium whereby you connect the human to another human using other technologies. Then put him on a plane. I heard one story one time. Somebody had to put somebody on a plane from Western region to Ottawa for a 1 day work, cost an arm and leg, hotel, travel, etc. That happens. And it have, Grace mentioned the 6-hour drive. It does happen. I mean, those are the problems that you were able to solve. I'm wondering how many other problems we're not able to solve because of distance, and how can we solve them? And that's what I was getting at in my question. I wasn't trying to promote technology or anything. I'm just trying to figure out. So I am from Somalia. I live in, I don't know, the one of the territories, and there's not many people from Somalia who lives in the area, and I've got an issue and I need an interpreter. Do I not explain my situation to whoever the service provider is, or do I wait for somebody to show up 2 days later or 3 days later, or do I use some sort of a technology to connect me to solve the problem? Those situations do happen, by the way.
I think it's what Grace was saying, is that we have the various modalities for interpreting, and
do you use them?
And each has its place. And yes, we use all three.
Oh, okay,
so
cool.
Definitely. I mean, BC, like all of the provinces, big expanse of territory, and with the, as the immigration policies and stuff like that change, with people and refugees too moving out of the bigger hubs, there's more of a need now in what we would have called more rural, not necessarily rural, but less urban than the lower mainland spaces. So there is a need to be able to connect to an interpreter out in the areas that you wouldn't necessarily have those languages, as you're saying, available. So it's about ensuring that there is a means, again, around this equity piece, that there is a means to be able to do that communication and interpreting. I also wanted to just mention, just around, this is not about AI and interpreting, but it's about how healthcare is really moving to, not completely, but moving to digital spaces in a lot of ways. And then it's about how do we integrate, how does that language equity piece land when we're talking about digital health or virtual care? All of those things, like where are the communication intersects that we need to be aware of, and how do we make sure that the interpreter is there? Like that's kind of the landscape that we're working in now, and we're trying to, like these digital things are like being set up like this, it seems, but and we're trying to, like say, can we talk about the language piece, or what is that piece around equity that we need to really be aware of, whether it's around the accessibility for somebody who's deaf, or for spoken language interpreting, what that means. Something else to consider.
Grace, have something to add?
So many times language support is an afterthought after other services have advanced, improved, and evolved. And I think it just needs to always be on the checklist. So if we are now able to have a remote consult, how are we getting the interpreters being part of that remote consult? It always needs to be a part of all of our service changes.
Now, I know something as basic. I worked in telemedicine years ago, and worked with several technology companies in implementing telemedicine applications in a variety of places here in Canada. One of the things, like just as basic as the patient file record, for instance, the language of preference is always, I know some of them do have them, some of them don't, but a language preference on the patient record needs to be like French or English. Have we expanded that to other languages? I don't know. What's your thoughts from, let's say, Ontario, Grace? Had we changed that?
One of my pet areas when it comes to sociodemographic data is the language of preference or the comfort language. And so, yes, we are absolutely putting a lot of work into making sure that service providers are asking that language screening in a consistent and similar way, and that they're capturing the data in a similar way. So, yes, a drop-down list of more than just a couple of languages, and then revisiting that list always, because there are more and more languages that we're supporting all the time. So again, the idea of that is even a living document, that drop-down list of preferred language, and having people comfortable with asking that question.
Yeah, don't be shy about it, right?
Mm-hmm.
Yeah, absolutely. How is it going in Manitoba in that regard, Alana?
Yeah, we've done lots of work in Manitoba in that sense as well. And so that information is now being collected more consistently. What we're trying to work now to achieve is associating that question with ensuring that the staff asking the question also are making individuals aware of the availability of professional interpreter services at the same time. So it's not just about asking what language they prefer or are comfortable receiving service in. It's tying that question to the knowledge of what supports can then wrap around that individual to help them achieve that safety and comfort.
Absolutely. And this is a huge difference here between the conversation I had with our American colleagues on the topic and this conversation that we're having here today. In the US, for instance, the service provider, be it independent, they could be a clinic or a doctor or a hospital. Those are independent corporations. They're obligated to provide the service, but there'll be like any other business. There'll be cost cutting in some cases, and in some cases they don't. In some cases they do. It takes a lot of prodding, encouraging, or trying to push the idea forward to get the interpreters in the room where they need them. And I take it, like, because of our healthcare system, the way it's set up, it's a universal healthcare. In Canada, it's a publicly funded healthcare. I'm assuming those services are part of that. Am I correct, Kieran and Alana? So they're budgeted for them and all that stuff, just typical like you would do with anything else, I'm assuming.
Yes, in Manitoba, that's the model. You're correct.
Yeah.
But Robin, it's not the case across the country, and I think
that's why I was trying to understand this where it goes, right? So
the impetus, the motivating factor in the US, and there are many things that make us different, but the motivating factor in the US is the business model around healthcare and the presence of insurance companies in that, right? We don't have a unifying agent in Canada as unifying as those, the laws around that the US have. So we end up having this fragmentation in certain areas. Not that I want to be motivated by liability, and I'm not advocating for that. I'm just saying that kind of really changes your mindset as well when you're utilizing language services and how that interpreter comes to be in your presence.
Well, it allows the conversation to focus on equity and language access and providing the service for those who needs it, versus thinking about it like as the other conversation that I've had is and we're talking about it here in the health center of service delivery, right? There are many aspects where we deliver these types of services in Canada. They're not connected to the health industry or the health sector. Private banks, insurance companies buy these services. Many other types of industry buy these types of services. and not necessarily just the healthcare sector. But in this context, in this conversation, we are talking about it in the healthcare industry or healthcare sector in Canada. So there are many considerations from other industries, but specifically for the health industry in Canada that is publicly funded, budgeted for, focusing on the care, so focusing on access to the language that you're comfortable with. And there is a distinction here for the audience. I'd say if you're the word comfortable in the language, it's very, very important. I speak 4 languages, but somebody asked me what your comfort level in any of those 4, I'd say English, but that's fine. Doesn't mean I can't go to a bar and order a beer in 4 languages. I can do that in 10 if I wanted to. But the idea is that you are comfortable in the language, meaning that if you're talking about something serious, do you get the 100% full comprehension and answering questions, understanding and answering questions, playing back, speaking back in a very concise, very well thought out manner. And if that's not what you're comfortable with, that's where you need interpretation.
I also, just to add to that, I mean, we know in healthcare that when people are at an emotional high stress level, as well as elderly folks, they revert back to their mother tongue. So you might have been completely fine, and now suddenly you don't know it. The other thing that I found interesting was research on, risk, and how when risk is put before you, if you're hearing it in a learned language, it doesn't sound as risky as if somebody were to say that in your mother tongue. You might feel that risk a little bit more. I always equate it to, like when we swear in our mother tongue, how that feels just so much better than if you're swearing in a foreign language. That just seems like a word. So it's how language is also connected to our emotions and what that means in healthcare. Like this piece around risk was really, when I read that, I'm like, whoa, that's a really important thing to remember, and how people tend to revert back to their mother tongues when they're just in stressful situations. So I think those are really important things for healthcare providers to understand as well, that, this person might seem fluent because maybe they can say they need to go to the washroom, but anything beyond that, maybe not.
I've noticed it also with certain diseases. Like my father recently just got diagnosed with the starting or the beginning of dementia. And I know my dad used to speaks English, speaking. He manages English, okay. But all of a sudden his English is almost gone now. And back to your point there, Kira, now he's, back to Arabic, for instance, right? You bring a very valid point. When you advance in age, you have 2-3 languages, you don't have the brain capacity anymore to control them or to manage them or to learn them. You end up reverting back to what your mother tongue is or was. Great. How are we doing so far? Is this the conversation you wanted to have? Angela, what else we missed? What do you like to cover?
I think it's great. I think it's wonderful. I think, I think it's wonderful. And what you were saying earlier, healthcare is not the only purchaser of interpreting services. Definitely the courts are, and the whole legal system, the continuum of the legal system is from first encounter with law enforcement to, incarceration and post. It's very much reliant on that. But the legal system in various pieces does have some protection under the Charter for Access to Justice, which in healthcare we don't. But all forms of ministry services or provincial and federal government services rely on interpreters. And I think healthcare does tend to lead the way, but there are so many different areas where interpreters are required. And back to what Sylvia was saying as well, just around training, and probably because that's one of my main areas of passion, and because I'm with students and members in their professional development, I can just see every day how important training is, the nuances of understanding the implications of using one word over another, the implications of not understanding where you are, what the relationship is between these people in front of you, what can go wrong, your responsibility there. I always say the difference between a professional and a bilingual is that the professional interpreter understands the weight of their responsibility. It's massive, and it's in the training as a core step, but in the continuing, professional development, that is critical. It's a practice profession. It's interesting. We just did one class the other day, and I had a student that has come back after, I think 8 years was the last time she took the core training, and things change. Like, quite honestly, we evolve, right? The training has evolved, our positions, we learn as educators
Yeah.
As curriculum developers, we learn from talking, and interpreters come and tell us, that was not practical. That didn't work. That was not helpful. I need more understanding around this. When I take notes, what does this mean? You know, when somebody tells me to do, gives me 10 pages to cite, translate, and walks out on me, what do I do? Right? Even though I told them I'm not going to do that. So it's very, very important. The core training and the ongoing, professional development is very
And
important.
just as I'm just cognizant of the time here, almost coming up on the hour of recording. I would be remiss if I didn't mention it. Bill 96 is coming to an effect here June 1st. And I'd like to go around the panel and get your comments back, specifically, not necessarily on the written part of Bill 96, what it addresses from the signing and all that stuff, the signage and all that stuff. Don't worry about that one. There is an aspect of that. We'll address that in some other webinars. But there is some aspect of this on the legal part. You mentioned courts earlier, for instance. There's a change there, right? So the change is that you're not allowed to have an interpreter in courts anymore. You have to bring your documents all in, even if your two-party agreed on a certain language, English in this case. The court will not accept the documents unless they were in French, and the conversation has to be conducted in French with the judge. I don't know, any comments around that? I think you were mentioning earlier, like, the access to languages and all that stuff. So I was wondering, but that goes against that, I would say. I don't know. I mean, if we're trying to accommodate, in the case of Kieran and Alana, almost 100 languages each, how is that possible?
Well, Sylvia, you're the court expert.
Yeah, unfortunately, I'm not like super familiar with like this bill and what it would entail. I know Robin very kindly was explaining that, and I know like here in Canada we have a very unique context. We haven't talked about this aspect of things, but it's like the whole thing about having two official languages, which makes Canada really very special. It makes us very specialized in translation and interpreting, because in Quebec there are a lot of training programs, unlike here in BC and everything else. I don't feel like I'm really qualified to comment on it, but I just want to say, from my perspective of being an interpreter, like a working interpreter, working in medical situations, in court situations, all of those kind of things. I'm going to go back to what Angela was saying, which I think summarized beautifully what an interpreter's work is about. It's about expressing yourself fully and understanding fully what's going on, and whatever gets you to that place, right? So I would say something, I would characterize it as being good or bad, like the more or less it serves that ultimate goal. And the same with everything else we've talked about, the same with, do we use remote interpreting? Do we use AI? Like, I would go back to that question. Does it help the person access their language rights? Does it help them express themselves fully and understand the situation fully? And that's how I would consider any changes in legislation with that lens.
Okay. Anybody else wants to add anything on that topic?
I think it's just pushing us to build capacity for French 2 interpreting. We've been very much across Canada focused on English 2. So it's an interesting opportunity right now for us to build that pool of interpreters.
Absolutely. That's a silver lining. I love the way you think, Grace. It's great. You created an opportunity. Excellent. Of course, we're coming up on the hour, and I don't want to take too much of your time. But before we do the closing, I want to make sure that we've addressed the high-level topics that we want to address today. I know it's a broad topic. We can talk about it for days. This is the first conversation. Don't worry, we'll bring you back. And then we'll focus a little bit more on more important, a specific slice of our interpretation industry in Canada. Maybe next time we'll do a specific topic on ISO, or we do different topics on technology that runs it, etc. So we'll get a little bit more concentrated in our conversation next time. But for this time, I just wanted to meet you. You meet each other, and we have a conversation online, live, and talk about the interpretation industry in Canada. It's a great opportunity to see you as well. So any final thoughts before we do the closing?
I just wanted to clarify something. I'm sorry, Robin, because I didn't want people to walk away with this understanding. So yes, as Alana said, that it's a centralized budget, as is with BC, but I don't know if that's the same across the board in Canada. Each health region organization is going to do their own thing. So although it is public funded, that money has to be put against a line item that is about language access and interpreting. And I don't know if that happens everywhere. So I just wanted to make sure that people understood that it might be different somewhere else.
Yeah, absolutely. Thanks, Karen, for clarifying this. Any final thoughts, Elena?
No, this was a great opportunity to be able to ways to collaborate further and identify those common goals. I think we have ideas for improvement. Thanks for bringing us all together, Robin.
No problem. Grace?
Lana said it perfectly there.
Thanks for joining. Angela?
I think that it's time. I think it's past time for us to have a national conversation around interpreting in Canada. And if that is, perched on access, equity, inclusion, then we need to look at that. But I think that's what we need to do. And so offline, I hope that we will be able to gather and have that conversation to further strengthen what we already have, right? And as Alana's saying, leverage what we have to grow.
Absolutely.
And thank you very much, Robin,
Oh,
for
no
allowing
problem.
this to happen.
Anytime. Sylvia?
No, just not much to say. Just thank you so much for having us here and giving us this opportunity to start this very interesting conversation, because I feel like interpreting is a big deal. And when we're interpreting, we are accompanying people usually through a vulnerable situation, often through a really, really bad day. And I think people deserve the support of having language access. They deserve to have a human there who is not just, but is also a professional and will know how to handle the situation in the way that is best. So I'm very glad that we're talking about it. And thank you for having me.
Absolutely. Thank you for joining us. Thanks for joining me. I really appreciate it. So I want to thank you, everybody, for joining us. Really appreciate your time today. I know it's Friday, and it's 4:00 Eastern. Still, I think Grace and I don't know, Grace, do you work like till 6:00 or something? My day never ends, but here you go, I guess, respecting the 5:00 quit time. So I want to thank everybody for joining me today. I really appreciate it. The panel, thank you for the contribution. Thanks for the wisdom. Thanks for the information you shared. I really appreciate it. Hopefully, this is one of many conversations to come. I love to make interpretation in Canada as a specific set segment in the Localization Fireside Chat that we can probably connect every 3, 4, 6 months, whatever the frequency you guys want. And then we could bring you back in here and do a pulse check every once in a while on what's the latest in the interpretation world and in interpretation world in Canada, obviously, and tell the world about what's going on. Because as much as we think that this is a national thing, I think as you saw in World Speak and a few other conferences that we were holding in the country, you're seeing a lot of eyes coming on us from outside the country. They're trying to learn from us. We are expert in our fields, trying to learn from us. They think Canada is a great opportunity. There's a lot of people are engaging in Canada from a language industry perspective. And it is, large bilingual country. I mean, with many demographics represented. So it stands to reason that has to be an opportunity for the language industry in Canada. So I thank you for your participation. I really appreciate that. And also for our audience, I want to thank you for listening in. If you're live on YouTube or live on LinkedIn Live, thanks for joining me today. I really appreciate it. If you have any questions, you can send them through the channel to me. Happy to send them to the appropriate panelist, and we'll answer them for you later. We'll put them in the comments. At the same time, I want to thank you for engaging with this content, because this episode is recorded. We are going to publish it. We're going to produce the episode itself. We're going to produce about a dozen short videos of the episode. We're going to put them on YouTube as well. And we're going to produce a blog post for the episode summarizing our conversation. And we're going to do an audio podcast, which will be available on Spotify, Applecast, and the rest of the audio podcasting stations. So tune in to whichever channel you prefer. Again, as a reminder, this channel is a personal initiative by me. So it's not sponsored. It's not paid for by anybody else. This is just me being crazy passionate about this industry, who loves to spend the weekend editing videos, I guess. So there you go. Thank you for supporting me and liking and sharing this content. I appreciate it. And for everybody, stay online for 1 minute after they stop the recording. Thank you so much.